Welcome to the tutorial for the Registered Addiction Specialist examination. This is presented by Breining Institute, which has provided higher education, training, testing, and certification for the addiction professional since 1986. This tutorial can be used with the Addiction Professional Manual for Counselor Competency, and you can use either the first or second edition of the manual. The second edition expands and updates the first edition of the manual, but all of the test material is covered in both editions. This review course will identify every area, everything that may be asked on the written multiple choice exam, and if it is not in the manual, it will not be on the exam. The tutorial and the exam are divided into 4 subject areas: understanding addiction, treatment knowledge and application to practice, professional readiness, and counselor competencies. There are 100 questions on the exam, and each question has 4 possible answers. You want to pick the best answer based on the information contained within the manual. If there's a conflict between your experience and the material that is in the manual, answer the question based on the information in the manual. You can see how the questions will be distributed on the exam, how much will be covered in each area, and we will be covering the material fairly quickly. One of the benefits of this video presentation is that you can stop the video, take your notes, then replay or continue at your own pace. We recommend that you watch the tutorial, highlight or underline the sections identified in the manual, then go back through the manual and study the information that we've pointed out. If you know the material pointed out in this tutorial, you will pass the exam. Chapter 1 includes information about what is needed for the RAS certification, which includes 155 hours of formal alcohol and other drug education, 2,080 hours clinical experience, which is about 1 year, and included within that clinical experience you need 160 hours of supervised experience, and then you need to pass the RAS exam. The first edition of the manual contains some alternate certification options, but those were grandfather provisions back in 2005, and those are no longer applicable. The RAS credential is nationally accredited by NCCA, State of California ADP approved. In fact, it was the first approved and accredited certification in California for addiction counselors. And then the RAS is also recognized by NADAC as a qualifying credential for the NCAC 1 and MAC credentials. If those are important to you, any of those approvals or accreditations, you can get more information from our website. Also, once you pass the RAS exam and get the certification, that also sets you up for advanced credentials, such as a clinical supervisor credential, a master counselor in addictions credential, which is a master's level. You need a master's degree for that also, as well as specialty credentials. If you are a California employer or work for a California employer, 30% of the staff must be fully certified by April 1st, 2010. ADP, which is a state agency that enforces that law, has been very diligent in enforcing the counselor certification provisions, and they've recently stepped up their enforcement activity. Certification as an RAS meets this requirement. If you are a counselor in California, you must be registered within 6 months by a state-approved agency as a counselor. That would be like registering with Breining Institute, and then you have 5 years to become fully certified. So if you were a counselor in 2005 when the certification law went into effect, then you have until 2010 to be fully certified. You need to renew your certification every 2 years, and during that time complete 40 hours of continuing education. The second edition of the manual contains the current law as of 2009, and the first edition contains an earlier version that's no longer applicable. For the RAS exam, know the provisions identified in the slides that we've just presented, and if you want to see what the current law is in California, go to our website or go to the state ADP website. In Chapter 2, know the chronology items, especially those printed in bold, and understand what it is telling you. For example, is alcohol and drug use a recent phenomenon or one that has been around for thousands of years? Know the facts and figures related to the extent of the problem. For example, the U.S. Assistant Secretary for Health says that 20 to 25% of people hospitalized have drinking or alcoholism problems. or that 40 to 50% of fatal vehicle accidents are associated with alcohol intoxication. In Chapter 3, know the different types of programs that are aimed at addiction problems. For example, know about recovery homes, drinking driver programs, outpatient, non-residential programs, hospital programs, how long a person might stay in one program or another, and know who Marty Mann was. Chapter 4 is about families and family roles. Know the relationship between a community and an organization as it relates to the family system and subsystem. Understand the differences between clear, rigid, or disengaged natural boundaries within a family community organization. Know what the U.S. Census says about families and stepfamilies, and understand the different roles that family members may take on as they try to achieve balance in the addiction-impacted family. In Chapter 5, know where the Latin word personality comes from. Know the differences between id, ego, superego. Know about the Myers-Briggs test. Understand Erik Erikson's 8 stages of psychosocial development and know the general differences exhibited by well-adjusted versus addictive persons in dealing with fears and anxiety. In Chapter 6, know the definition of the terms in bold type. For example, know what the difference is between prejudice and bias. Know the difference between ethnic and cultural stumbling blocks and building blocks. Know the factors that might increase a woman's risk for alcohol problems. Know the people generally included in ethnic groupings in alcohol research. For example, a Latino would generally refer to people from Cuba, Mexico, and Puerto Rico. And know the general prevalence of drinking among different ethnic groups, according to those studies.